Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thank you for joining us for today's webinar, a live Q&A on home health Medicare billing. My name is Cully, and I am the Product Marketing Manager here at Axxess. Axxess is a leading technology company offering a complete suite of easy-to-use, innovative software solutions, empowering more than 9,000 home health, home care, and hospice organizations to grow their business while making lives better. Joining us today are speakers Sophia Saldivar and Betsy Thomas. Sophia will be assisting today as a moderator and presenter. She has a background in home health and is currently a product manager for us. She's responsible for the research, development, and execution of Axxess solutions. In addition, she provides internal and external education to Axxess staff and clients, as well as partners with various teams to effectively communicate the company's innovative products. Prior to Axxess, she worked as a biller for her family's home health agency, after which she held numerous roles such as administrator, chief financial officer, and consultant in the home health industry for more than 10 years. Betsy Thomas is the Senior Manager of Revenue and Recovery Services at Axxess. In this role, Betsy leads the team of billing account managers who handle the revenue cycle management for our billing and recovery clients, which to date has processed more than $14 billion in Medicare and managed care claims. Prior to her time at Axxess, Betsy had been in management roles in the home health industry for over 10 years and has created processes and led teams with the purpose of streamlining operations and increasing cash flow. Thank you both for joining us today. I want to remind everyone that today's session is being recorded and will be shared along with our slides to all registrants. The slides are also available for download in the GoToWebinar handouts panel section right now. On our next slide on the agenda, you'll see what we'll be discussing today. So we will begin with a presentation of common or frequently asked questions, as well as going through the submitted questions by registrants. Those that submitted, thank you so much. There were hundreds of questions submitted. And we're also going to walk through some billing scenarios and some recent issues that are being encountered. Please note that everyone is currently muted, but during this time, you may submit questions through the questions box function of GoToWebinar. Sophia will select submitted questions, and Betsy will also be reviewing the questions from the chat box, and we'll open it up for additional Q&A to help answer those questions following the initial presentation. And also just want to note that for an overview of 2022 Medicare billing changes, I will be dropping a link in the chat to our Axxess Help Center, which has a page of FAQs and other video and blog resources that your team can reference. Now I'm going to pass it to Sophia to kick us off.
Hi, everyone, and good day. We had some frequently asked questions come in. Some that, again, that Cully just said are available on our website, but we wanted to start off with this question. Does the OASIS need to be completed by the clinician, coded, finished with QA, and fully submitted for the NOA to be billed within the 5-day window? And the answer to this is no. That does not need to happen in OASIS. OASIS does not need to be completed in order for you to submit that NOA. It's important that the NOA is submitted timely. And so we wanted to make sure, CMS wanted to make sure that that was done efficiently, and so they removed the requirement for that. That is the same that we are currently, the same process that we are currently experiencing with, or that we were currently experiencing with the no pay wrap as we've transitioned over into the NOA. So hopefully our organizations have gotten a little bit more comfortable not submitting that OASIS within that time frame.
Yes, and so for current patients' NOA submissions, the organizations, they can use the start date of the billing period to serve as the service line to submit the NOA. So as Sophia mentioned, CMS has loosened some of the requirements that are needed in order to submit that NOA. So our next question, and this is another one of our frequently asked questions, is do we need to put in an actual primary diagnosis when submitting the NOA, or does it just need to be a placeholder? And once again, CMS has loosened some of the requirements needed to submit that NOA. So it does need to contain a primary diagnosis, which can be generic. And so the principal diagnosis on the OASIS, it does drive the clinical grouping under PDGM, or patient-driven groupings model for the HIPS code. But the HIPS code is not required for the NOA submission, and a generic HIPS code can be used to submit the NOA if the OASIS is not available. And just to note that in our software in Axxess Home Health, the generic HIPS code that will be used is the 1AA11, and it's used to submit the NOA, and it's not actually for reporting purposes. And so the final claim will store and report the HIPS code and the claim amount from the assessment. So again, the actual diagnosis is not required when submitting the NOA.
Our next question is, if Medicare is not the primary payer, should an NOA still be submitted? And this is our guidance. Our guidance is yes, even if Medicare is not the patient's primary insurance, submitting an NOA is always recommended. We know that sometimes we don't get the up-to-the-minute changes to insurances on our patients, especially between November and February, when everybody's changing between HMOs, Medicare Advantage plans, private insurances, as well as coming into traditional Medicare. So that's something that we do suggest you continue to do. It's a good practice for those patients, particularly that you do know are maybe dual patients that are more prone to being picked up by these HMO insurances. It's important for your organization to be reviewing the billing and claims requirements for each of these managed care payers to ensure proper and timely claim submission. So really our guidance and suggestion for those HMO payers is to have that conversation with them, find out if your HMO is going to require an NOA or if they're simply going to accept a final claim. Our system does solve for those issues. And so we do have a video out on our website that walks through the HMO payer setup and goes through that process. But yes, we do feel that, and we do suggest that you submit that NOA regardless of if the patient is currently traditional Medicare or an HMO patient, just to ensure that it's submitted timely in case that the patient did switch over.
All right, next question. Again, this is a common question that we see, and that is, are there any Medicare Advantage payers that are requiring the NOA submissions? And the answer to that is yes, there are a few Medicare Advantage payers that do require NOAs to be submitted. And we recommend that organizations contact the Medicare Advantage plan and inquire about the changes that have occurred in 2022. And some of these may include the NOA submission. So it's really important that you review the payer setup in your EMR or your software system and update based on what the Medicare Advantage plan is suggesting. So Axxess Home Health can accommodate each payer's requirements, and the requirements can be modified to fit the payer's effective dates. And that's especially if the effective dates differ from the Medicare start date of the NOA, which is January 1 of 2022. So in addition, we've listed just a few of the payers that have adopted the NOA process, which is MyNexus, which based on our recent communication is that the NOA is required. TriWest is no NOA, but they are requiring the final only. Same thing with Molina and Humana. No NOA is required, but they are requiring the finals only. And again, we would like to just emphasize that you do reach out to your Medicare Advantage payer just to confirm and get all the additional information that is needed, because again, there may be changes with, within the actual payer, just different plans might have different requirements. So we strongly encourage that you reach out to each Medicare Advantage payer just to get all the information that you need so that you can make any necessary updates in your EMR so that you can have successful billing set up.
So this question was from one of our current organizations, our current clients, And that is, does Axxess Home Health provide reports to determine what NOAs are at risk for being timely? The answer to that is yes. Our EMR has solved for really counting for you, so that's not something you have to worry about, providing the ease of use to streamline your operations. And that tool is called our RAP and NOA aging tool. And so at the top, you'll see we have a screenshot here displayed for you all. You'll see that big, thick red bar. That big, thick red bar is identifying those particular RAPs or NOAs that have not yet been submitted in a timely fashion. And we do have markers for those that are still in a good frame, whether that's today's the start of care or a few days out. And then we have some cautionary days available for you to identify there as well when you're reviewing these aging reports. This is important because we do know that there is a penalty if this NOA is not submitted timely. So it's important to just be viewing this and having this really easily accessible to your billers is important.
Thank you, Sophia. So another one of our questions that we see often is what should be done with an NOA that is in a return to provider, or also called RTP status? And should the original be corrected or should it be canceled? So the best practice for this is when an NOA is in the RTP status, it can be corrected and resubmitted directly in Axxess DD or the Medicare direct data entry black screen system without being canceled. So basically what this is saying is if you have the NOA, and it's returned to you, what you want to do is identify exactly the reason why it was returned to you, and then make any necessary corrections on the NOA itself, and to simply resubmit it without having to cancel and create a new NOA and resubmitting it, because at that time, you don't want to run the risk of it being late for any reason.
With the recent changes with NOAs, do I still need to obtain the UTN for my final claims if my state is under a review choice demonstration? This was another frequently asked question that we got, not just with our NOA, but as we transitioned over from RAPs to no pay RAPs to now our NOA. And we just wanted to reiterate that no, the RCD requirements are separate from the NOA submission. So if an organization has opted for the pre-claim review portion or option of RCD, the finals need to be submitted with that UTN number. The one-time NOA should still be submitted within 5 calendar days, but not submitting the NOA doesn't mean you can't submit your RCD, and vice versa.
Another question that we see often is if our organization submits the NOA timely but needs to cancel it because of an error, can we file an exception on the initial claim? And the answer to that is yes. If the NOA was originally received in a timely manner, but then it was canceled with the type of bill or TOB 032D, and that type of bill is for the cancellation of the admission or NOA, and it's resubmitted to correct an error. What you would need to do is enter the following remarks on the final claim to indicate that this is, the reason why, and you can state on the remarks section timely NOA, cancel and rebill. And what that will do is it will let the reviewers know at your MAC that this was initially, the NOA was initially submitted in a timely manner, but for whatever reason it had to be canceled and rebuilt. And so you would append the modifier KX or add that modifier KX to the HIPS code on the 0023 revenue line of the period of care or your final claim, and the agency should resubmit the NOA promptly, generally within 2 business days of correcting the incorrect NOA. So this is really important that agencies are mindful of that time frame and resubmit that NOA, that corrected or that new NOA as quickly as possible.
Yes, and this is important too. Some people think that you have to change your physician on the NOA if you're inputting that information there. You don't have to. The physician information is something that comes over from your OASIS report as well. So that information will be pushed into your final claim for reimbursement. So I believe there may have been a question about what we would need to do for the physician name. If there's a way to change that, you can go ahead and wait till the final bill is pushed so that you can identify that that was the physician certifying the patient. Just to add on to this.
Thank you, Sophia.
Sure, going on to the next question. Oh, I'm sorry. We're actually going on to some billing scenarios. Apologize, I'm not reading titles over here, people. Forgive me. Here we go. So our first scenario is going to be that our home health organization had to submit an NOA past the 5-day window due to a tornado. What do they do? The response to this is that the organization should submit the NOA as soon as possible. Now that we are working from home, we know that there are so many different avenues where, so long as we are able to access the internet, we should be able to submit that information. So that's one thing that CMS does take into account. So we want to make sure that we're still working to submit that information as soon as possible. But if the NOA was submitted beyond those 5 days, the final claim should be submitted with the KX modifier and with a remark indicating the reason for that delay, and to see if and to request that exception. CMS ultimately determines approval based on qualifications. The 4 circumstances that may qualify for those exceptions are fire, floods, earthquakes, or other unusual events that inflict extensive damage to the home health agency's ability to operate. Another circumstance for exception is an event that produces a data filing problem due to a CMS or MAC systems issue that is beyond our control. We'll give you some examples of this in just a little bit. Number 3 is you are a newly Medicare certified home health agency that is notified of the certification after the Medicare certification date, or you're waiting for the user ID from your MAC. This is important for a lot of those startup organizations that you know you're good to go, but you haven't received that letter yet. You want to make sure that if you're already set up to start billing or pushing in those NOAs, you can go ahead and put that onto the final claim, that KX modifier, in case that information doesn't come in on time. And the last circumstance for possible exception are other circumstances that your MAC might determine to be beyond your control. And so again, we'll look at those particulars 2 and 4 in just a bit.
Right. Another billing scenario that I think a lot of agencies may come across is we have our patient Diana. She began services on January 5th of 2022, and the home health organization submitted an NOA that was accepted. Diana had a medical event and was transferred to the hospital, and she was discharged from the home health organization on January 14th of 2022. And then on January 21st of 2022, Diana was readmitted back to the same organization, to the same home health agency. So the question is, does the organization's biller need to submit another NOA? And the answer to that question is yes, the organization would need to submit 2 NOAs for this patient. The first one would be on January 5th of 2022 for the initial admission to the home health agency. And then the second one would be on January 21st of 2022 for the readmission from the hospital. So if the patient had been transferred but not discharged and a new billing period had begun when the resumption of care was completed, then the second NOA would not be needed. You would only need a final claim for the subsequent billing periods needed in this situation. So essentially, what the NOA needs to be submitted every time a patient is admitted, whether it's a brand new admission or the patient is discharged and readmitted into the same agency or different agency. A new NOA needs to be submitted within the 5 calendar days.
The next scenario that we have is Best Care Home Health biller is not sure if he should use condition code 47 in transfer situations. Does he enter condition code 47 on an NOA if the previous home health organization, Compassion Home Health Care, has discharged but not processed their final claim, or would this result in a late NOA? So the answer to this is, in home health, a transfer is when the beneficiary transfers from one organization to another within that 30-day period. The receiving agency or organization, Best Care Home Health, should submit the NOA with a condition code of 47, regardless of whether Compassion Home Health Care has submitted their final claim or not. You want to make sure that you are identifying the date that you've admitted that patient for care, and that you've identified that condition code 47 to alert CMS that that patient is no longer with its former provider, but they are now currently associated to your provider number. So that's important for billing purposes in the end, because you want to make sure that in situations where it might be a PEP or it might be a LUPA, that you are getting fully reimbursed for your services. Sorry, continued on with this is that the condition code 47 may also be used when that beneficiary has been discharged from the organization, but they've not filed, right? That's something that we just talked about. We want to make sure regardless that we are submitting that particular NOA, again, for timely filing purposes. And also, there can be situations where the previous provider can come back to appeal if they may have received less reimbursement because of that. And so you just want to make sure that the date that you have really truly solidifies your presence in the patient's home.
And one more thing I wanted to add, Sophia, is the last statement on here. So you do not need to add the condition code 47 if you are bringing that patient back into your own agency. So if you discharge the patient and readmit the patient in the same agency, you do not need that condition code 47. That condition code 47 is used when a patient is transferring from one agency to another.
Thank you for pointing that out, Betsy. Appreciate that.
All right, we have another billing scenario here. So patient Ian is a Medicare beneficiary who has switched from a Medicare Advantage plan to Medicare, but the home health organization was notified after the fact. How should the home health organization revenue cycle team proceed? And the answer to that is, since the home health organization or the agency did not find out that Ian had disenrolled from the Medicare Advantage plan until they received a denial, the team should submit the NOA as soon as possible. The corresponding final, it should be submitted with a KX modifier and a statement in the remarks indicating that the beneficiary had disenrolled from the Medicare Advantage plan. So there are many times when a patient may not communicate that back to you, or you were not able to check the eligibility in a timely manner, and you find out much later that that this change and disenrollment had happened. So the best way to handle that is to submit that NOA as quickly as possible. And then on the final claim, you just put that modifier, the KX modifier, and then the notation that that the beneficiary had indeed disenrolled from the Advantage plan.
Okay, so now we'll get to start talking about where we're at now with our NOAs. We know that last year with our no pay wraps, we had some situations at the beginning of the year where our no pay wraps weren't getting submitted to CMS, or they weren't getting accepted. We had some issues this year as well as we've adopted this change. And one of those was the NOA RTP, which is Return to Provider Reason Code 32114. This reason code is regarding an issue where the zip code is missing from your NOA. CMS is aware of the issue, and they're actively working to correct those particular claims that have still not yet been corrected, or particular NOAs, my apologies. We are telling our clients, and this is some guidance from CGS. Their guidance is to rectify this error. You want to first verify that your DDE logins are active. And you can do this by clicking for our particular users or our clients, you can do this by clicking on that blue DDE black screen button at the top right corner of your Axxess DDE platform. And step 2 will then be to access the claim center when you are in black screen and enter that specific 9-digit zip code. So you want to have that 5+4 and resubmit the claim, which we all know is that F9 key. So we just wanted to make sure that this was information that you had on hand in case you were still seeing some of those NOAs show up with that 32114 reason code. This is only affecting batch claims, so if you're manually entering NOAs or submitting ones individually, you should be okay to process that way. But still review your acceptance and review your claim summaries in your respective billing EMRs. Now, if your NOA has been late due to this issue, you can enter the following text in the remarks section, and that would be January 2022 issue regarding 32114. So again, this would be the information that you would put in the remarks section of your final claim.
Thank you, Sophia. Another issue that we may come across or have been coming across is NOAs have been returned to provider or RTP'd with the following reason code 19960 in the status or location code TB 9900 and had the condition code 15, which was not entered by the agencies. So in this situation, Palmetto is still working to resolve the issue. And for most of the NOAs that were affected, what Palmetto did was they removed the condition code and removed the 19960 prior to returning the NOA back to the provider. And this allowed many, but not all, NOAs to process. So some NOAs may still return to the provider and be in the status location TB 9997. So with these, Palmetto's reviewing the NOAs for resolution, and no provider action is required at this time. So and the update to that is providers will need to request a late NOA exception on the corresponding claim or final if it was late due to this issue. And in this situation, again, we would put a notation or remark, and it should say something like late due to CC or condition code 15 release. And these will be, reviewed and should be processed.
And these, we wanted to make sure to highlight these for you, not just because of their issues currently, but also they provide opportunities for us to really teach on understanding the use of the KX modifier, right? These are situations beyond the agency's or the organization's control. This is something that was on MAC's side. They're aware of it. They've already, addressed the concern. And so those claims, provided that you're following their instruction, those claims should process smoothly, or those NOAs should process smoothly. Now, when you are looking through issues, when you see more come up, if that happens, let's hope that it doesn't, but if it does happen, there's different areas where you can monitor that within the respective MAC's websites. And so we have provided those links for you all here. The handouts, again, are available for you guys on the GoToWebinar page. If you want to look through those gray title pages, you'll see handouts as an option there for you to click and download these PowerPoint slides. These links are active, so you can click on them once you get them into your computer and save these bookmarks to your browser. They are important. I'm sorry, go ahead.
Oh, no, I was going to say it's important to monitor these regularly because, as you know, Palmetto, CGS, NGS, they can make updates, frequently. So it's important to monitor these regularly.
Yes, absolutely. And CGS has actually given us a job aid based on that 32114 code that we spoke about just a little bit ago on how to manually submit those NOAs in DDE. DDE is the same for anybody that is submitting to a MAC. So if you're at Palmetto, CGS or NGS, excuse me, you can still use that same billing aid to walk through the manual submission of an NOA in DDE.
Sophia and Betsy, that was a fantastic rundown of our frequently asked questions. Here's some references and resources available, as well as Sophia said in the slides. we've had a lot of questions submitted beforehand, but we'd like to encourage more questions. So if you have them, please submit them using the questions box. And Sophia and Betsy will review these and select ones for our open Q&A now at this time. And to give our viewers a few moments to enter their questions, Sophia and Betsy, can you talk about, I know that you mentioned that there was a recent issue that has shown up that we did not get to cover in today's presentation, as that just came up, I believe, these last couple days. Do you want to kind of expand on that?
Sure. So Cully, thank you for mentioning that. So here recently, and this is happening with the CGS MAC, there were some NOAs that were returned to provider with reason code U like umbrella, 537F like Frank. And so that reason code is showing that, the NOA or that patient might have another home health agency listed in the common working file, which may not be the case, but this seems to be an internal issue with CGS. So what their recommendation is just to hang tight, and they are reviewing this at this time. No provider action is required, and they will update the website excuse me, as they continue their research on this. And again, that reason code for some of these RTPs is U537F, and that is with CGS.
And again, just to reiterate what Betsy was saying, use those links that we've provided here in this handout to be monitoring, there'll be these over here, to be monitoring those MACs for any updates to resolutions. They will have a tracking guide for you of when they discovered the issue, and they will give you updated notices for each issue that it comes up. So that's just important to note. One of the questions that we got in asks, can you explain what situations require an NOA for patients who were on service prior to January 1st of this year? Do you want to talk to that, Ms. Betsy?
Yes, absolutely. Thank you. So with patients that were on service prior to January of 2022, we would still need to submit an NOA for those patients, and it would be a one-time NOA. And these would be considered crossover NOAs. And when those NOAs are submitted, they would need an artificial admission date reflected in the NOA that's sent over, and that date would be the from date of the start of the billing period. So if you admitted a patient, let's say, December 15th of 2021, they would, and if they're still on service, after January 1 of 2022, let's say their billing period, the next billing period would start on about January 16th of 2022, you would need to submit that NOA and have the admission date as January 16th of 2022. So all patients that are still on service after January 2022 must have an NOA submitted. And your system should allow, should pull the first date of the billing period as your artificial admission date. And that is, go ahead.
Go ahead, sorry. And just to confirm that for Axxess DDE and Axxess Home Health users, that is something that is already part of the logic or the automation of our system. So that's not something that you have to worry about. You can process any NOAs that are coming through in your billing center accordingly based on your aging tool.
You guys did a wonderful job. Thank you for sharing all that information. And I do see a number of other questions in the chat. So we're going to try to get to as many of these as possible. And if we don't answer those questions today, our team will follow up with you.
I know we had a question earlier. I think someone was asking, are there any changes as far as timing is concerned with submitting finals? And the answer to that is there are no changes with the time frame of submitting the finals. But again, as in the past, we've always had to make sure that the OASIS is exported orders must be signed, and your notes must be completed. So those requirements have not changed, but of course you want to, submit your finals as quickly as possible because, you're only paid on your finals. So the timing has not changed for the finals.
And to add on to that, auto sequestration or that auto cancellation, right? Whenever you had an untimely final or you were waiting on a final to come in and you hadn't yet billed it and that 120 days had been up for the wrap, that no longer plays over for the no pay wrap, as well as for now the notice of admission. So that's just another add-on benefit really of the NOA becoming something that we've adopted in home health, because we know that that's not going to be recouping that monies isn't going to be something happening for our organizations. We got another question in here. I believe we answered it earlier, but it says here, I noticed that the NOA process does not list an NOA process does not list the physician name. What is the correct way to change the physician name after submitting the NOA? And again, just to reiterate on the OASIS, you'll have the information of the physician. Their NPI is located on there as well. That's really the important number for CMS to see on that UB04. So as long as that number is associated to the correct physician and that they are PECOS verified, they can go ahead and submit that final claim through and you'll get proper reimbursement. Now, of course, you want to make sure that you have all of your orders signed properly by the certifying physician, and if that information or that physician changed, that there's proper orders established for that as well. I was looking at some questions, so give me 1 second, guys.
And I noticed before the webinar, we had a number of folks ask about the diagnosis code. And I know we mentioned that in these slides, but we'll just mention once again while Sophia's looking up some of the questions here. So the diagnosis, it does not have to match your OASIS. It's merely a placeholder, for your NOA. So it does not have to be the diagnosis that is actually on your OASIS.
We've got it. Thank you for that, Betsy. Sorry, I've got a question for us now. We have a question here from Annette. Do we need to discharge a patient if they switch from a Medicare Advantage plan to Medicare during the episode and reopen them under Medicare? Yes, I would. That's always a suggestion anytime somebody comes off of a Medicare Advantage plan or a PPO plan into Medicare. You do want to discharge them and start them all over and process that new NOA. This also is some of the education that is coming from CMS. It was part of the examples that they gave in their final rule. So it's something that we wanted to reiterate because we know that there are some organizations who have a different policy, but now with this NOA in place, it's just important to change this workflow just a little bit. Let me get another question here. If we find out late that a patient went from Medicare Advantage to Medicare and the NOA is late, will we still receive payment?
Can you repeat that question, Sophia?
Sure. If we find out late that a patient went from Medicare Advantage to traditional Medicare and the NOA is ultimately late because of it, will we still receive payment?
So the important thing to do with that is to send that NOA as quickly as possible. And when you do submit your final claim, you want to put that KX modifier and then put a remark on your final claim indicating that the patient had disenrolled from the Medicare Advantage plan and submit it with that notation on there. And if you have to provide additional details later, you may want to be ready to do that. But that should give enough documentation because it was out of your control, getting that NOA in a timely manner.
Yeah, exactly. So long as you're submitting that as soon as possible and not changing really any of the information, making sure that your admission date still is jiving with your actual billing period or episode period. You don't want to have to discharge the patient again just so that you have that empty space. Make sure that you are, billing Medicare for all of the work that you're doing and showing that that's being done when it was done, just to make sure that that flow is evident for them on CMS's side.
Right, right. And I think one of the questions that we had gotten earlier is about, what happens if you don't submit the NOA in a timely manner. So similar to the no pay wraps, there is a penalty that will be, put onto your final claim. So there is, the final claim will be deducted 1/30th for each day that the NOA is late. So it's very important that those NOAs are submitted in a timely manner, especially if you have a LUPA. So if you have a LUPA and you have visits that were done in those first few days that you happen to be late, unfortunately your final claim may not be reimbursed. So it's real important to keep that in mind, is that 1/30th penalty that will be imposed on your final. So again, I think it's good that we were kind of getting ready for the NOAs during no pay wraps. It kind of prepared us in getting these submitted in a timely manner.
Thank you for that. Let's see, another question that we're getting here. We did just address the U537F. Apparently, though, Palmetto is also having this issue. I have not yet seen that on the Palmetto website. We've just seen it on the CGS website. So thank you to Michelle for adding that information in here. That's what's really awesome about these Q&A sessions that we have here at Axxess with our industry partners, because we're able to collaborate this way and have this information out to our masses. We'll make sure that we put this information into our information available, our websites available for these resources. So thank you for that, Michelle. We appreciate that additional knowledge. I have another question in here. Reason code 19960. Medicare is reprocessing a rejected NOA with this reason code, but the claim received is not the original date. It is showing a correction date as a received date. Do we need to worry about it? I would say this is probably a situation, and I want to ruminate on it a little bit more, but it sounds like this might be a situation where KX modifier should have been used just to identify that a timely NOA was submitted at the beginning, but then a cancellation was made. However, that notice of admission for the patient in particular is associated to your organization. So maybe something else is, some other information is being corrected, but so long as you have identified that there was a connection between your organization and the patient on the date that you admitted rather than what the correction date is saying, you want to make sure to appeal that. Let me see what other questions we have. Give me a second.
And another question that had come in, Sophia, was about some of the best ways to get the NOA submitted. Of course, you want to make sure your intake process is, solid. So, as soon as you're able to enter the patient's information and the referral information in, and you have an admission date, I know with our software, it's very seamless as far as, being, having that NOA ready to go as soon as, the patient is admitted. So that's one thing you want to make sure is that your intake process is pretty seamless, so that as soon as you are admitting that patient and you have the necessary information in the system and you have your physician's order, it's very, very important that you do have a physician's order that gives you clearance to be able to admit that patient and perform any services on that start of care. So as long as you have those, the visit is done and the physician's order is in place, you should be ready to submit that NOA, hopefully within the same day or as quickly as possible, because, to avoid any kind of delays or anything slowing down the NOA submission process, you want to get that submitted within the first day or two as much as possible. And again, that kind of goes back to making sure your referral and intake process is pretty solid.
Yeah, absolutely. And this might be an opportunity where you review your process from 2021. Did it work? What didn't work? What did work? And that you implemented a little bit more tightly in your organization just to make sure that that flow is seamless. One of the questions that we got here is if a patient was admitted and the NOA was submitted on time, but after the admission, the patient was transferred and dies at the hospital, do we have to cancel that NOA? This was a question from Benito Ramirez. No, you will not have to cancel that NOA. You want to make sure that you're still able to submit payment for the time that you were able to see the patient, even if it was just for a start of care, even if the patient went into the hospital 2 days later. You want to make sure that you're able to, pull every visit for reimbursement that you're able to get that for. Usually when a patient expires, it is a full episode payment depending on where the patient expired and what that documentation is. So that's something that's important to note here when you're having those conversations about NOAs. You want to keep that NOA still submitted, and you want to ultimately properly close that claim and that case for that patient. And that would be with the discharge and the OASIS submission and all of that. And one thing to note is, even though the conditions haven't changed for our final, we want to reiterate one of those conditions is that the OASIS is still submitted within 30 days of the assessment completed date. Even though we don't have to submit that OASIS anymore at the beginning before the wrap, now with the NOA, we don't have that anymore. We do still have that timely submission of the OASIS to ensure payment from Medicare. We do know that if that's not submitted within the 30 days, we can get completely denied for those particular visits, that episode in question.
Absolutely. Sophia, another question that I had noticed is about condition code 07, and that is for patients that are receiving hospice care at the same time as home health care. So please make sure you are not putting the 07 condition code on your NOA, because that will cause it to RTP. So the only condition code that is permitted on the NOA is the 47 condition code. And once again, that is for patients that are transferring from another home health agency to your agency. But any patients that need the 07 condition code that are receiving hospice services, you would put that condition code on your final claim and not on your NOA. So please keep that in mind so that you don't have any unnecessary RTPs.
Betsy and Sophia, we have time for maybe 1 to 2 more questions. I don't know, Betsy, if you see any that we've missed here in our chat.
I actually have some here. I have some saying that there's a couple of codes that they're seeing floating around. I do want for us to investigate internally. And so if we do have updates to those codes, we'll make sure to add those to our website. So be sure to look at those resources that we have available for you all. And again, just track CGS and Palmetto's websites for any additional information. The other part of this is when we do get that information for those codes, we will make sure to email you individually that have given us those codes to review and look at. We do have a billing team that Betsy is our manager for, senior manager of our billing services team. And so we actually did poll them as well to see what other issues they might be seeing. Some of these have not come across our desk just yet, so we want to look at them a little bit more closely. And we'll be sure to reach out once we do have a little bit more research done and a solid answer for you on those. So I just wanted to make sure that we're not ignoring those questions. They're definitely something that we want to review and make sure that we're providing the industry with the appropriate education.
Absolutely. Thank you, Sophia.
And I'm looking for one more question. I think we have time for one more.
Let's see, I am looking through as well.
We have a question here. Is batch mode for NOAs accepted now by Palmetto? They are not yet accepting batches from what we know. If that's changed, it's not something that we know yet. So it is best to send those still individually. And again, you can reference that job aid if you're doing it manually in the Black screen of DDE, or you can utilize our EMR services to implement that, or rather submit that to your appropriate MAC as well. And I think that that's all we've got time for today.
Yes, thank you guys so much. You shared a lot of expertise and wisdom today. For our audience, don't forget, we will email everyone a link to the slides and the video recording for the webinar. And in a moment, all attendees will see a GoToWebinar survey pop up. Please take 2 minutes to share your feedback and thoughts on today's webinar. By the way, if you haven't checked out the Axxess user community, I encourage you to visit community.axxess.com. It's a great place to share information, ask a question, and connect with other Axxess users, including Sophia and Betsy, to keep learning and growing. And we thank you for your time today.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.